Anahita, a public health professional and a researcher. Currently, I am working as assistant professor at James Lick Institute, Switzerland. Epidemiology in pandemics matters. Let me start with some basic questions regarding a disease or a virus spread. If I ask you, what is this disease? What are the impacts of this disease on human health? How serious is this problem? What is the origin or source of this disease? What are the characteristics of this disease? What are the mechanisms of transmission? What are the most important symptoms associated with it? And so on. You may agree that these are only few of the many questions that researchers like us around the world in different areas of knowledge are trying to find answers, and it may take some years to understand the impact of any pandemic, especially pandemic that we are facing in the second decade of this century. Is there an end to this tunnel? Will we see a light at the end of this tunnel? As a researcher, we do believe it exists, and the answer is epidemiology. It's true that for many years, epidemiology gave us knowledge that changed human history. The cholera epidemic in 1854 that took place in Victorian London challenged the scientific principles that we use to explain the health and disease process. A scientific method unveiled the causal relationship between the cholera and contaminated drinking water. After which, John Snow became the father of modern epidemiology. Since then, epidemiology became a fundamental instrument for understanding disease dynamics in the human population. In 1980s, epidemiology was applied to understand HIV epidemic, and now today in 21st century, we are trying to understand Zika virus epidemic and even coronavirus pandemic. Epidemiology is essential to fight against any disease. I would say we have many reasons to believe that epidemiology may help controlling any outbreak, epidemic, or even a pandemic. Pandemics have changed epidemiology, and epidemiology is changing with time. We now see many researchers, many epidemiologists, and even scientists are collaborating with each other. They are coming from various parts of the world, various areas of knowledge, and different fields. They are sharing their data, they are sharing information so that they can contribute to improve public health in some way. Nowadays, epidemiology has become an amalgamation of researchers coming from various areas of knowledge. From a public health perspective, it is important to fight against any disease, control the disease from spreading, and even to prevent any disease from occurring. The second epidemiological transition back in 20th century took place. Before this, the framework for any health system was confined to acute treatment, emergency care, and long-term care if needed. Initially, it was assumed that epidemiological transition is a unidirectional process, which starts with an infectious disease and ends with a non-communicable disease, eventually death. However, time suggests that this transition is quite complex and dynamic in nature, in which health and disease evolve in diverse ways. It is not a static process, rather a continuous transformational process in which disease disappears and others reemerge. Emerging and re-emerging diseases have the potential to wipe out humans from planet Earth, be it a developed economy or a developing economy. Nations around the world are facing double and even triple burden of diseases. Changing mortality, changing causes of death, changing morbidity is quite evident with this transitional process. Interestingly, the approach of epidemiologists has changed. Epidemiologists are now looking into every possible aspect of disease and its impact on human health. It is not confined to produce knowledge, scientific knowledge, and give us epidemiological data. The fundamental role of epidemiology has grown. It's not just a knowledge of disease, its nature, its natural history, characteristics, and so on. There are a lot of fake news, claims, and misinformation attached to it nowadays. Every epidemic, even a pandemic, gives us a new angle to think, a new direction to go. Every conspiracy theory should be combated. This shows us how a pandemic changes epidemiology. Many factors play important role in this transition process, such as demographic factors. For instance, if people become healthier, rate will decrease automatically. The living environment, the lifestyle of the people, modern medicine are other important factors for this transition process. For instance, use of antimicrobials for several years have made microorganisms resistant towards it. A very known and evident disease is tuberculosis. We see patients becoming resistant to initial therapy. The environmental pollutants coming from industries, wars, and even atomic bomb explosions. All these pollute the air we breathe, pollute the water we drink, and results in chronic diseases such as cancer. Urbanization is one of the reasons for migration of people from rural and remote areas to urban areas. Migration is also causing overcrowding in urban areas. The increased density of urban areas facilitate rapid infection spread. Another angle of seeing this change is the wellness of the people. It is not limited to the physical health, but nowadays mental health, social health, emotional health, and all other aspects of health have become important for everyone, even for the researchers. We are now concerned with our mental health, our relationships with our family and friends, thanks to epidemiology. In this modern era, we are now concerned with the well being of our service providers. Healthcare workers, frontline workers who serve the people during a crisis and they still serve after a crisis or a pandemic is over. It became an important target population for the researchers to see the impacts of any virus or a disease on their personal life, on their professional life, how their roles, responsibilities, stress level, mental state has changed in a pandemic. How are they handling it? How are they coping with it? This is a different aspect of epidemiology that we are seeing in 21st century. It is helping us find answers to such questions. As a concluding line, I would say, with time we observe the changing pattern of disease. And this is a continuous process of transformation because some diseases disappear and some come back. Epidemiology is important to make a difference in public health and address various challenges that we may face in this transition process. Epidemiology will keep evolving with every new emerging disease. For instance, adapting quickly to change is one of the lessons that we learned in recent times. Adapting to stay quarantined, live in isolation, away from the loved ones, working from home, following preventive measures and precautions and whatnot. These are just a few examples. Epidemiology is important to shape future of public health. Thank you for listening.